So, hi everyone. My name is Dr. Shayla Toombs-Withers here at Essence of Health Wellness Clinic. Thank you for joining me today. Now, so today is May 1st, and this month is American Stroke Awareness Month. So, today we will discuss the importance of stroke awareness, how it relates to coronavirus, and how you can decrease your risk of stroke. So, I will begin today by discussing first what is a stroke. Stroke, also known as cerebrovascular accident (CVA), which you may hear referred to, is actually a disease that affects the arteries leading to and within the brain. Stroke is actually the fifth leading cause of death in the United States, and it's one of the leading causes of disability also here in the United States. So it's very important. So, how do you actually get a stroke? So, what happens is a stroke occurs when a blood vessel that carries oxygen and nutrients in the brain, that blood vessel is either blocked by a blood clot or that blood vessel bursts or ruptures. Following this, the brain actually can't get blood and its needed oxygen. So that portion of the brain and its cells will in turn die. And so, you know, we ask then, why, is this important? And we will get into that. So let's learn a little bit more about stroke first. So there are two different types of strokes. There are ischemic strokes, which are caused by a blood clot obstructing blood flow through those blood vessels. And then there is what's called a hemorrhagic stroke. And so a hemorrhagic stroke is caused by a blood vessel actually rupturing, preventing blood flow to the brain. Now, so why does this matter? So the brain actually serves as what we think of as like our controller mechanism for multiple functions and multiple organs of the body. It signals our lungs to work, it helps our limbs to move, it helps our organs to function. And so when these signals are actually interrupted, then the body won't function properly, which can lead to significant disability and death. And so the next part of this is, well, how does it relate to, what's currently going on with this global pandemic of coronavirus? So there has been some recent news that has come out over the past week or so, and it's come out of New York, where they have seen a significant number of coronavirus cases and deaths. They have seen several cases of patients under the age of 50 who are suffering from stroke. One of these patients was only 33 years old. Usually, stroke is something that we see in older individuals over the age of 60, 65. We don't usually see this in individuals who are under 50. And so that's why this is significant and a profound finding. All of these patients in New York, where they found these younger patients having strokes, they did test positive for coronavirus, but they were only found to have mild or not even any symptoms at all of the virus. And similar findings have also been seen and documented in Wuhan, China, according to the New England Journal of Medicine. Some suspicion is that this virus may actually increase your risk of blood clotting. And as we learned, previously during this talk, when those blood clots actually go to the arteries that supply the brain, then that's what leads to stroke. And so this is what we're seeing happening with some people who are suffering from coronavirus. So where are we at right now with coronavirus? Currently in the United States, this is data from the Centers for Disease Control and Prevention, the CDC. Currently in the U.S., there have been 1,031,659 positive cases of coronavirus and 60,057 deaths from coronavirus here in our country. New York and New Jersey continue to be the states with the highest number of positive cases and deaths. And locally here in Tennessee, where Essence of Health is located, we've had 10,735 positive cases and 199 deaths. This information is provided from the State of Tennessee Health Department. Here in Tennessee, Nashville and Memphis continue to have the highest number of cases. Here in Hamilton County, where Essence of Health is physically located, we've had 156 positive cases and 13 deaths. So this virus has had a significant impact on our country as well as here locally in Tennessee. So now knowing what we know about the incidence of stroke and how the coronavirus pandemic can further increase your risk of stroke. So how do we prevent this? How do you prevent from having a stroke and prevent this phenomenon? So one is a heart healthy diet. High blood pressure, diabetes, high cholesterol, heart disease, all of these things are risk factors for stroke. So having a heart healthy diet can actually decrease these risk factors, particularly a plant-based diet, a diet that where one has a high intake of fruits, vegetables, whole grains, limited intake of processed foods, and a very decreased or no amount of meat, dairy products, or oils, or additional sugars and salt added to your diet. So this manner of eating can significantly decrease your risk of these chronic diseases that can contribute to stroke, thereby decreasing your risk of stroke. Exercise is another way to prevent stroke. So when we increase our physical activity, it lessens, once again, those risk factors of chronic diseases that contribute to stroke. The next important thing to remember is don't smoke. Smokers have a 2 to 4 increased risk of stroke when compared to non-smokers. And beyond that, smoking also increases your risk of those chronic diseases that we discussed, like high blood pressure, heart disease. So it also increased your risk of developing those diseases, which further increase your risk of stroke. So it's important to not smoke. And if you are a smoker, it's important to quit smoking. The next thing is see your doctor routinely to make sure your heart is healthy to decrease your risk of stroke. Because when you go for your routine physical exam, I recommend everyone has one at least once yearly. And if you have other significant health problems, you probably should see your doctor more than that. But at least go once a year, let them listen to your heart, let them make sure your heart rhythm is normal, let them make sure your heart rate is normal, let them make sure your blood pressure is normal, let them do routine labs, make sure your blood sugar is normal and you haven't developed diabetes. Have your cholesterol checked. Make sure you aren't at increased risk of having cholesterol plaques that can block your blood vessels and increase your risk of stroke. So see your doctor at least once a year for a routine checkup. Also, there's a disorder called atrial fibrillation, which is irregular heart rate and rhythm. And so another reason to see your doctor to make sure that your heart is beating normally as it should, because atrial fibrillation can also increase one's risk of stroke. And because we are seeing that having coronavirus can increase your risk of stroke, reduce your risk of getting infected with coronavirus. So things that we've talked about early in this pandemic still ring true. So still make sure that you're washing your hands routinely and regularly, remembering that we have to at least spend 20 seconds at minimum of washing our hands, or using a 60% alcohol-based hand sanitizer, being sure to cover your nose and your mouth when you're going out. So wearing a mask on your face when you're going out to protect yourself from coronavirus, keeping a distance from others. So keeping that 6 foot of distance to prevent those respiratory droplets from potentially infecting you with coronavirus. So those things still ring true in terms of decreasing your risk for stroke. And then, more importantly, know how to recognize stroke symptoms and to seek help immediately. So there's a great mnemonic. It's called FAST. And some folks have probably seen it before because there's been a campaign for many years to get people to be able to recognize these symptoms of stroke, because it's not only important for yourself, but you can also help to save a loved one, a family member, or a friend from stroke if you're able to recognize these symptoms quickly. So we'll go through this mnemonic. So it's FAST, F-A-S-T. So the F part of that is facial drooping. So the stroke, like we discussed, it affects those arteries that lead to the brain. And so part of the brain's function is helping us to speak, helping us to move our mouth, helping our muscles to contract and move. And so when that portion of the brain is affected, you can see one have a facial droop. What a facial droop actually looks like is that one, usually if you see a person smile, for instance, you'll see one side of their face not moving equally proportionally to the other side. So F is for facial droop. So that's a symptom to look for. The A part of that is arm weakness. Once again, when that part of the brain is blocked, then you can't move your arms and your limbs as frequently. Paralysis is a known disability from people suffering from stroke. So arm weakness. So if you see a person, usually you hear, a lady may have been shopping in the grocery store and she suddenly dropped the groceries out of one hand, or you see a person who's trying to lift their arms and they can't lift both arms equally. So arm weakness, they may be suffering from a stroke. So that's the A of FAST to look out for. The S of FAST is slurred speech or difficulty speaking. So if you've also seen some other cases of stroke where, family members say, yeah, we were talking on the phone, and then suddenly their speech just sounds garbled, or, it sounds like a person may have been drunk, but they hadn't been drinking. And so slurred speech, because once again, our brain center helps our body to form words, to use our muscles to form speech, our muscles to help our tongue help us to speak. And so when that portion of the brain is blocked, that can affect the way that we talk and the way that we sound. So S is for slurred speech. And then the T in FAST means time to call 911. What we have learned in people that suffer from strokes is that time is everything. The quicker that you can get a person to a hospital who is able to take care of that person and recognize that they have a stroke and intervene immediately, then that greatly increases that person's risk of survival from that stroke. And that also lessens their risk of having debilitating lifelong injury from the stroke. So time is everything. So as soon as you recognize these symptoms in someone, or you even just suspect that they may be having symptoms of a stroke, you want to immediately call 911, immediately seek help, because time is everything when it comes to the brain. So remember those symptoms. Remember that mnemonic FAST. F for facial droop, A for arm weakness, S for slurred speech, and T, time to call 911. And so these are my thoughts today. Be aware of stroke that is out there and how it may affect you and your family members and how to prevent it. The essence of health is in you. Remember, you can find Essence of Health Wellness Clinic also on Instagram at Essence of Health Wellness Clinic. We also have a YouTube channel that you can subscribe to at Essence of Health Wellness Clinic. I, Dr. Toombs-Withers, am still accepting new patients, so feel free to reach out here on Facebook. Feel free to call the office at 423-225-2245, or you can reach me on the website, www.essenceofhealthwellnessclinic.com. I continue to waive the enrollment fee to join at this time, as many are suffering from the coronavirus pandemic. So that $75 enrollment fee is waived, saving you money. And I am going to look here and see if I have any questions today. So hi, Celeste, and hi, Joyce. Thank you both for joining me today here. And as always, I will wrap up this talk, but as always, if people have more thoughts or more questions that they would like to ask, feel free to put them in the comment section of this talk, and I will get back to answering your question. I am also going to place in the comment section more information about stroke, because I do want you guys to be aware of that, and information about that mnemonic we talked about fast, so that you can help a loved one or a friend or a total stranger, even if you happen to be in the grocery store and see that person drop those groceries, from suffering from debilitation or stroke. So you all have a good weekend. Take care. Thank you. Bye-bye.